Hello, Dr. DeMarco. Um, Dr. DeMarco is a clinical chemist and has an expertise in protein misfolding disorders and in vitro diagnostics. She applies her expertise in protein biochemistry, analytical chemistry, and laboratory medicine to build new biofluid tests for immediate use in patient care. Her work is 100% driven by clinical demand. That is, Dr. DeMarco and her colleagues at St. Paul's Hospital work collaboratively with healthcare providers and patients to build biofluid diagnostics to fill unmet needs in medicine. And of course, today, Dr. DeMarco is here to talk about the who, what, where, and when of Alzheimer's disease biomarker testing. So welcome, Dr. DeMarco. We're so pleased to have you join us.
Thank you, Laurie, for the kind introduction. It's great to be here and to have this conversation with so many of you that have joined in. All right, so let's jump into the who, what, where, and when of Alzheimer's disease biomarker testing. And I really do appreciate this opportunity. It's a bit of a full circle moment for me because the Alzheimer's Society of BC is one of the first organizations we reached out to quite a few years ago when we were aiming to set up this testing, and they supported us with research funds to help us achieve our goals. Okay, so for today, we're going to look at a few of the basics around Alzheimer's disease biomarker testing that's now offered in BC and across Canada. And there's several points here. I tried to pick out a few big topics. Of course, we can't cover all of them today, but we'll certainly look at what biomarkers we're actually measuring with this testing. Who is the testing meant for? And conversely, who is it not appropriate for? We'll look at when testing is recommended and where would one go to actually get testing, as well as what is the impact of testing. Laurie, I'm just pausing for a moment to see if I can fix my camera, which I can't. Okay. All right,
yeah,
we'll just
I'm
proceed
sorry
on.
about that. It's you. I will say you are coming through perfectly.
Okay, perhaps you can spotlight it or turn on the spotlight if it's not on. All right, so we'll start off with what biomarkers are being measured. Okay, so first of all, what does this test do? Well, it provides a measure of the changes that are occurring in the brain as a result of Alzheimer's disease. So it kind of gives us a signal as to what's happening in the brain without looking directly at the brain. So for this test, we are testing cerebral spinal fluid, which is the fluid that surrounds the brain and the spinal cord. And this is ideal fluid because of this close contact with the brain tissue, which is the tissue affected by Alzheimer's disease. The biomarkers we're measuring are called amyloid beta and tau proteins, and I will go into a lot of detail on these, so not to worry. So biomarkers are a general term we use to describe markers that are in the human body that are signals of health or disease. So like your cholesterol is a biomarker, glucose is a biomarker for diabetes. So you can understand this is sort of a general term, and the specific biomarkers for Alzheimer's disease are these amyloid beta and tau proteins. Okay, so let's look at a little bit more detail. Why these biomarkers? Well, let's look at this in the context of what happens during Alzheimer's disease and this progression from healthy through the disease stage. So here we're looking at a cell in the brain, a neuron, that's healthy. So this is what, a healthy depiction of a neuron. And as Alzheimer's disease progresses, what happens to the cells in the brain? Well, we start to see these clumps of proteins that form both inside and outside our brain cells. And as things progress, this gets a little worse, and then neurons start to die off in certain areas of the brain. So these proteins that are clumping together, these are amyloid plaques, which are shown here in orange, and tau tangles. Amyloid plaques are the defining feature of Alzheimer's disease. So this is how we confirm with absolute positivity that someone has Alzheimer's disease pathology, is we really need a section of their brain to confirm that these these proteins have clumped together. What's actually in these plaques are proteins called amyloid beta, and a particular form of this called amyloid beta 42. And for the tau tangles, these are formed of tau proteins, and there's a couple different types of tau proteins, and we'll talk about those a little bit more here. So this is the defining pathology in Alzheimer's. As I mentioned, we need to see these clumping together. We all have these proteins in our brain right now. I am at this moment making amyloid beta 42. I am making tau proteins. That's normal. So these are normal proteins that are found in the human body and in the brain. But what's different in disease is that they clump together. So this is abnormal, this clumping process. And this is the defining feature of Alzheimer's disease, in particular, these amyloid beta plaques. You can see these aggregates of tau in other diseases like frontotemporal dementia, but these clumping together of amyloid is specific to Alzheimer's disease. We have amyloid beta 42 forming these clumps outside of the cells. We have tau that forms inside the cell. Tau is actually part of the structure of these cells. So it's a structural component, like the framing of a house. So as these neurons are damaged, they actually also leak tau out into the surrounding fluid. Okay, so these are the changes that we see, as I've shown, in brain tissue as a result of Alzheimer's disease. Now, of course, getting a section of brain tissue as a diagnostic is not a great approach, right? So we need an alternate approach. And for that, we have the cerebral spinal fluid that surrounds your brain and your spinal cord. And the nice thing about this is that some of the changes we see in the brain are reflected in cerebral spinal fluid. So we'll look at, firstly, those tau proteins. What happens to those tau proteins? Well, as the neurons are damaged, I mentioned they can leak these tau proteins. So we actually see an increase in the cerebral spinal fluid as a result of Alzheimer's disease. So you can think of this kind of akin to, your bad cholesterol. When it's high, it's bad, right? You want to keep it low. I've listed a couple different types of tau. That's just different flavors of this protein that we measure for diagnostic reasons. Phosphorylated tau, denoted here phospho-tau, that's a particular form predominantly found in these fibrils. So it's increased when you have these clumps of tau tangles that form. The other protein we talked about is this amyloid beta 42. What happens to amyloid beta? Now, this is a little different because we have these clumps outside of the cell. So in cerebral spinal fluid, what we actually see is a decrease of this amyloid beta that's floating around. So kind of like a seesaw effect, whereas it's clumping in the plaques, it's sort of drawing it out of cerebral spinal fluid. So we actually see a decrease in cerebral spinal fluid. So this is the characteristic signature of these biomarkers related to Alzheimer's disease. A decrease in amyloid beta 42 in the cerebral spinal fluid and an increase in these tau proteins. And this signature is useful both diagnostically, so to determine if someone's symptoms are due to Alzheimer's disease or not, but also risk of progression. So someone who's experiencing mild cognitive symptoms, this signature puts you at high risk for further progression of those symptoms, versus someone who doesn't have this signature in the cerebral spinal fluid, they would have lower risk of progression of their symptoms to more severe symptoms. So I wanted to talk, I mentioned cerebral spinal fluid, so we should talk about how we collect cerebral spinal fluid. Cerebral spinal fluid is collected via lumbar puncture, and that's how we collect it. It's collected from the spine, it's not collected from around the head. The LP is done by your doctor in a medical clinic or in a hospital. It doesn't really take that long. It's about 30 minutes for the procedure itself. Required some time to sterilize the area, do the collection, but they're really only taking out a really small amount of fluid, so about a tablespoon of fluid. And to do the testing, we actually only need a fraction of that. So it's a very small amount of fluid. And it's deemed to be a safe procedure. There are some potential side effects like headache that are rare that you would talk about with your doctor before proceeding with testing. Okay, so we have our biomarkers we talked about that we're measuring them in cerebral spinal fluid. The key biomarkers are amyloid beta and tau, because those are the key proteins involved in Alzheimer's pathology. This test is very good at telling us about the changes going on in the brain, but it's not perfect, right? There's rarely a test that's perfect. So this is why your results are used by your doctor along with other medical information to arrive at a diagnosis. And that's why I have this puzzle piece here, because this biomarker testing is a piece of the puzzle. It can be a very helpful piece of the puzzle in certain circumstances we'll talk about in the upcoming slides. Okay, so we've reviewed what the key biomarkers are. A lot more to talk about there, but I think that's a good summary for now. Next, we'll look at who the test is meant for. Okay, so who is this testing meant for, and really who gets to decide who gets this testing or who it's appropriate for? Well, a lot of work has gone into this. It's actually decades of scientific and medical research of these particular biomarkers and individuals with symptoms in various contexts and how these biomarkers are useful, what their diagnostic accuracy, so all this data on them. And what was actually done a few years back is an international panel of medical experts were assembled and rigorously evaluated the performance. So how accurate are they in diagnosing Alzheimer's disease? The safety of the whole procedure, including that lumbar puncture procedure, and how the test results could potentially help patients. And this group developed guidelines for appropriate scenarios in order to utilize testing. And we'll look at those in here just a moment now. To understand appropriate scenarios, I thought it best to look at sort of the spectrum of Alzheimer's disease, across progression. So from no symptoms down to more severe symptoms. So we know now that these biomarkers change actually even before symptoms occur. So they can change years before the first symptoms occur. And you can think of it kind of like a heart attack. The day a heart attack occurs is not the first day that that person had trouble with their heart, right? Something's been developing for a while, but it wasn't until there was enough damage that something occurred, in that case, a heart attack. In our case, presentation of cognitive symptoms. So when we're thinking about testing, at the stage where there are no symptoms, testing is not appropriate. When we move to mild symptoms, even very mild symptoms, that is when testing is appropriate and most utilized. It's also appropriate at later stages if there's some concern about the underlying diagnosis. So to summarize, testing is only appropriate in persons experiencing the signs and symptoms of Alzheimer's disease. To help understand when it's appropriate, I think it's good to discuss when it's not appropriate. So I pulled out a few examples, some common scenarios I get, and some common examples to help us discuss appropriate and inappropriate utilization of testing. So one example is a person with no cognitive symptoms. So let's say this person has no symptoms, but they're concerned to see if they will one day get Alzheimer's disease. This testing is not for you. Another example, you're experiencing symptoms related to your brain health, but your doctor determines that the symptoms are not consistent with Alzheimer's disease. This again is not an appropriate utilization of testing. As another example, if you are experiencing symptoms consistent with Alzheimer's disease and your doctor is confident that the diagnosis is Alzheimer's disease, testing is unlikely warranted in that circumstance. And we'll break these down a little bit more to discuss them in more detail. So this first example, a person with no cognitive symptoms but wants to see if they will one day get Alzheimer's disease. So the main point here is that testing is not intended for healthy people. This collection of cerebrospinal fluid and testing of these amyloid beta and tau proteins isn't a test that we would perform in healthy people. It's not like a screening test. I talked about cholesterol, where you might be screening for heart health to see if maybe further follow-up testing is warranted. It's not that kind of test. The screening test for Alzheimer's disease is more those cognitive symptoms you're experiencing. And that early screening your doctor would be doing just based on your symptoms and input from you and potentially a family member. This testing is done at a later stage where more specific testing is warranted. And we'll talk again about that in a little bit. So the same applies here. If you have a family member that has Alzheimer's disease and you want to one day see if maybe you'll get Alzheimer's disease too, it's rarely warranted. I mean, I can think of some very select particular indications there, but really on the whole, that's not the indication. You have to have symptoms for this testing to be warranted. Okay, so the other scenario we want to look at is you are perhaps experiencing some brain health or memory symptoms, but your doctor determines that the symptoms are not consistent with Alzheimer's disease. So based on your symptoms, your doctor can often identify the areas of the brain affected and help determine whether it's even plausible that this is due to Alzheimer's disease. If it's not consistent with Alzheimer's disease, then testing is not warranted. And I've pulled back up our neuron with Alzheimer's pathology because this testing is specifically looking for that Alzheimer's pathology. If Alzheimer's disease is not a diagnostic consideration, then this testing is not going to be helpful and it's not warranted in this circumstance. The third example that I brought up, so someone experiencing symptoms consistent with Alzheimer's disease and where the doctor is confident in the diagnosis. So this describes a typical presentation of Alzheimer's disease. If you have the typical symptoms of Alzheimer's at the typical age of onset, then biomarker testing is generally rarely indicated. And at this stage, the doctor can often make a confident diagnosis without the biomarkers. So in this case, biomarker testing isn't going to change your care, and in this case is not warranted. So those are some scenarios where it's not appropriate. Let's circle back to where testing is appropriate. One, your symptoms could be due to Alzheimer's disease. So there's really, I've kind of combined two things here, right? One, that you have some symptoms, and two, that the symptoms are consistent with Alzheimer's disease. And your doctor could help make that determination. Your doctor also advises that biomarker testing would be helpful at arriving at a confident diagnosis. So the doctor is providing advice that, this testing could actually help us arrive at a diagnosis and potentially help you manage care in some way. Third, of course, is that you consent to testing. We didn't talk about that too much, but this is an important part of the overall flow towards testing. And some circumstances in which biomarkers are particularly helpful include these unusual scenarios. So maybe symptoms that mimic other diseases or diseases that mimic Alzheimer's. So there's some kind of overlap there with other disorders like frontotemporal dementia, just to name one. That this testing can help kind of clarify which particular disease it is. So maybe your doctor's narrowed it down to two potential neurodegenerative disorders, and this testing might be applied in that scenario to help figure out which one it is. The other is a typical age of onset, so a younger age of onset. And again, where there is all these things up here apply, right? That there's symptoms that's due to something that could be Alzheimer's disease, and where biomarker testing is deemed useful by the physician at arriving at a diagnosis. So generally describing where there's some diagnostic uncertainty. Okay, so to summarize, not everyone with concerns about their brain health is an appropriate candidate for testing. Testing is intended for people that already have some of the symptoms of Alzheimer's disease, and not for healthy people who aren't symptomatic, who are looking for, that answer to, is it possible that I may get Alzheimer's disease one day, but currently I'm not experiencing any symptoms. This is not a screening test. It's a more specific diagnostic test that happens sort of further down the road in the medical care pathway. Which brings us to, when is testing recommended? So let's look at that in a little bit more detail. So when is testing recommended? So one, it's really at the determination of your doctor to advise when testing should be considered or not. And as we discussed, there's multiple reasons why your doctor might recommend against testing. And as we discuss, they might have enough information without this additional biomarker testing to make a diagnosis. So they're okay with the information they have and they can make a confident diagnosis. Or another scenario might be that testing might not change your care. Regardless of the outcome of the testing, there's a confident plan for your care. Or it might not be the right time, right? There might be other testing to be pursued, other things that the doctor wants to look at before they consider getting testing done. So it might just not be the right point in time for that testing. Your doctor will discuss the pros and cons of testing with you so that you can make an informed decision about whether to pursue testing or not. Importantly, Testing can only be ordered by a specialist in dementia care. So what does that mean? This broad term, a specialist in dementia care, is a doctor with specific training in dementias like Alzheimer's disease, frontotemporal dementia, etc., like a neurologist, a geriatrician, or psychiatrist. Family doctors are not able to order the CSF Alzheimer's disease biomarker testing. And we kind of discussed why, right? Because it's something that happens later in the care pathway. And we kind of sort of plot that out a little bit and look at sort of the pathway a person might follow in the medical system if they have concerns about their brain health. Their first and best point of contact is their family doctor to discuss symptoms they're experiencing, what's going on, maybe having a family member present to help inform, advise on also what's happening, their observations, and having that discussion with your family doctor. So for most people, at the family doctor stage, they can handle dementia diagnoses, can get a clear, confident diagnosis, but in select cases, they might refer for further evaluation and for further evaluation by a specialist. So this geriatrician or neurologist or psychiatrist. And this dementia specialist would again have another potential suite of tests, maybe pen and paper tests, other neuropsychological testing, gait testing. In addition, they have this biomarker testing available should they deem that is appropriate. So it's at this specialist stage that biomarker testing can be ordered. Okay, so we've looked at the when of testing. Next, let's look at where. Where do I go for testing? Well, you can go anywhere in Canada. So this lumbar puncture procedure can be performed in any suitable medical facility in Canada. So you have that lumbar puncture performed, that cerebrospinal fluid is collected. A little bit of that collection is then sent to our lab at St. Paul's Hospital in Vancouver, Canada for testing. We then test the sample here in Vancouver, and then we send the results back to the ordering physician. And that physician, that doctor, would then set up an appointment with you, go over the results. And as we talked about, they go over those results in the context of all other medical information that they've collected, other testing they might have done, whether it be imaging testing, these pen and paper tests, this gait testing, and they assemble all of that information to arrive at a diagnosis. St. Paul's Hospital in Vancouver, we actually serve all of Canada. We're the first and only lab to offer this testing in Canada. And this was really enabled through a long-term research project called Impact AD that we've been running in partnership with all our funding partners below that supported this work and other partnerships, including the Alzheimer Society of Canada. And as I mentioned in the opening, Alzheimer's Society of BC was really instrumental in really early stages of this work. And I want to jump into the study a little bit because this really reflects the impact of testing. So one more what to our what, who, when, where. So Impact AD was a study that looked at investigating the impact of this CSF Alzheimer's disease biomarker testing on multiple facets, and the three main pillars are shown here. One, we wanted to look at medical decision making. So earlier on, I talked about this expert panel that was assembled to decide when testing was appropriate and how it might be used. And really, they were using their best judgment. They weren't using data from actual patient management. So we wanted to gather that data in the context of the Canadian healthcare system because that data did not exist. We also wanted to look at personal utility. What is the value of this testing to the patients undergoing testing, their family members and friends that are helping them through this process? Again, that information was just not available. So we really wanted to collect information from the persons actually directly undergoing testing. And last but not least is looking at overall changes to health economics within Canada as we start offering testing. So this Impact AD study is a collaboration between persons living with dementia, their care partners like family and friends, healthcare professionals, so all those people you meet at the doctor's office, their staff, as well as researchers. We specifically sought the perspectives of persons both in BC, we had a BC-centric study, and also a Canada-wide study, undergoing biomarker testing as part of their routine medical care once they got to that dementia specialist level. So we sought their opinions on the testing process. They generously provided data about their medical care, and we were able to utilize that to launch this testing program in Canada and also make some positive changes in the healthcare system. So before I go on, I really want to stop to acknowledge and thank all of the persons that have shared their time and perspectives in both advancing the study and helping us make these changes within our healthcare system. Going back to our study pillars, I want to talk about these two because we have some of the first data in from these first two pillars about medical decision making. So what changes in people's medical pathways when they have the accessibility to testing versus not? And again, what's the value to persons undergoing this testing? So before I want to jump into this medical decision making, I have to remind you that this is applied to those persons meeting the appropriate use guidelines for testing. So those persons with sort of complex presentations, unusual presentation, or where there's some diagnostic uncertainty and or earlier onset of the disease, where biomarker testing was sought because in part the physician recommended to help clarify the diagnosis. So in that context, in this study, we found doctors reporting higher confidence in their diagnosis, and that leading to multiple downstream positive effects, including changes in their medical care, such as increase in appropriate therapies. So there are some symptomatic therapies available. We found those increased in persons positive for those Alzheimer's signatures and reduced in those Alzheimer's disease symptomatic therapies where they had a negative biomarker signature, as would be appropriate. Also I think this is a nice thing for persons going through the testing process, going through the medical system with concerns about their cognitive health, that this testing also decreased other additional diagnostic procedures like imaging tests, others doctor visits, because the physician was able to arrive at a more confident diagnosis earlier in the care pathway. And these findings taken together really demonstrate the value of early and accurate diagnosis using biomarkers and guiding medical care. So that's a quick summary of the medical arm. Now let's look at the personal utility arm. So what did patients tell us? What did their care partners tell us? Well, when we asked them about their decisions around actually having testing done, why did they choose to have this testing done? And for most of them, the vast majority said it was an easy decision to have the testing done. And so we asked them also why it was an easy decision. And this was around diagnostic clarity. So these individuals were seeking answers to what was happening with their brain health. And this testing offered them an opportunity to get greater clarity about why they were experiencing these challenges with their brain health. Another thing we talked to them about was after they learned the results. How did they feel about learning these results? And we learned something really striking and really surprising, I think, to everybody involved. The vast majority, again, reported overall positive feelings associated with learning their biomarker results. And then we had to ask why, this not necessarily good news, right, in this testing that's being delivered. But what they told us back was that again, around that certainty around the diagnosis, that gave them some assurances that they understood what was going on. They had a reason why they were having these symptoms. They were more able to communicate it with friends and family, having a better understanding of exactly what was happening. And so relieving that anxiety about not knowing what was happening. And for those that reported some negative feelings around receiving a diagnosis, many also reported that negative feeling was, again, quickly reverted to some positivity around, again, that same understanding of having that certainty around what was happening. The other thing we asked about is future planning and just general lifestyle activities. And one of the great things is that this biomarker testing, patients and their care partners reported that this really was a motivation in planning for the future, also keeping up and maintaining positive and healthy lifestyle choices. And so from this personal utility arm of the Impact AD study, we really found the value of early and confident diagnosis to persons living with neurodegenerative disorders, and not just Alzheimer's, right? Because this testing is both used to rule in Alzheimer's, but also can rule it out and point to another neurodegenerative disorder. So this is a diverse group of individuals that we're studying here, both with Alzheimer's as well with other neurodegenerative disorders. I thought I'd pull out a few words. I've talked and told you kind of the summary of some of these findings, but it's nice to see what people directly said in our interviews about this testing. So one person said this helped us to plan ahead, to make decisions, to be emotionally equipped to deal with this issue. Another individual said, I had so much anxiety over what was happening to me. After having the biomarker testing, I don't have that part of my anxiety anymore, so it's definitely helped me. Again, referring to that lessening of anxiety around that particular issue of not understanding, not having a clear understanding of what's happening with your brain health. And this information we couldn't have gotten from healthcare providers, right? This information is directly from patients and their family members and friends that are participating with them through this medical process. And it's just extremely valuable information that we were able to obtain direct from patients, and stuff we couldn't have, predicted at the outset that we would find in this group. This is my last slide, so we'll have a lot of time for discussion. But I did want to leave you with some more resources on what I talked about today. So if you go to the Impact AD for Alzheimer's disease, impactad.org website, a lot of what I talked about today, there's some resources there. So we have a pamphlet on the biomarkers I talked about that goes over much of what I discussed today. So you can download that. We have these available in English, French, and Chinese currently. We also have that more on the lumbar puncture. So I talked a little bit, there's a little bit more detail in here if you wanted to look over what that collection procedure involves. And also resources, both in British Columbia and in Canada. So 2 different resources guide for various dementia-related services, both Alzheimer's disease as well as other neurodegenerative disorders that our participants found really in our Impact AD study found really helpful. So with that, I'll conclude and we can perhaps jump over to some questions.
Great. Thank you very, very much. Boy, the questions have been coming in thick and fast. I'm going to start with probably the most technical question we had.
Go for it.
And I'm going to apologize to the person who posted it because I'm probably going to mispronounce the names. They are referencing research that was published in the Lancet and in Biomedicine in January 22 with Tunison et al. And Park et al. And saying published research about using blood biomarkers for determining Alzheimer's disease as an alternative to the more invasive lumbar puncture, I guess the CFS testing, or CSF, sorry. Would you please speak to this?
Yeah, so that's one paper, and there's certainly a number of papers. Today I thought I'd talk about current state as far as what's available medically in Canada. Blood-based biomarkers are a future state. Definitely, we're participating in research on this as well, and we hope to be able to deliver blood-based biomarkers one day. I do want to point to a couple challenges. So with cerebral spinal fluid, it's fairly straightforward. One, again, that fluid is in near contact with the brain, so a nice clear connection with the pathology. So when you go to blood, there's some challenges. One of them is now there's a whole bunch of other factors we have to consider and not just collect the CSF and measure it. So body mass index, liver, kidney health, all these other factors that could affect biomarker results that we really need to characterize and understand before we can provide thresholds of positive, negative, right? What's a positive signature? What's a negative signature? So there's some complexities in blood that we just don't have with cerebrospinal fluid. But as the questioner alluded to, this is definitely forthcoming. It's on the horizon, but not yet in clinical care. One of the things we have to look at, which we did with the Impact AD study, is how does it modify care? So there's a few different thoughts floating around on blood-based biomarkers, and I don't want to get too off topic because I know we probably want to focus on the cerebrospinal fluid biomarkers that are available now. But how are they going to modify care? So there's some thoughts as, for example, okay, a positive result would then, you would go on to cerebrospinal fluid to then confirm that result, where the cerebrospinal fluid has a higher diagnostic accuracy for Alzheimer's disease. So these care pathways we have to figure out. Where is the appropriate point in the care pathway to insert this testing? What happens after that? How do we confirm this? Who's going to follow up on this? So these are all things we're looking at and evaluating. But yeah, it's a great opportunity to be able to, I think we'd all love to move away from lumbar punctures. That is the ideal, but we have to make sure that we understand how it's useful. The worst thing is to make, a wrong diagnosis because you don't understand what you're working with, the material, the biomarkers, the fluid, and how all these other comorbidities and conditions can affect these biomarkers. So that's something that's actively being worked on, but I would say for sure we'll see those coming in the future here in Canada.
That's great. Thank you very much. And kind of jumping off on that a little bit, then how new is biomarker testing? And further to that, one person shared that her dad has gone through, as is not uncommon, several different diagnoses of different kinds of dementia, and says not one has offered this test. So do specialists know about it? So how new is it? And how widespread is the knowledge?
Yeah, so in Canada, very new. Very new. We've been offering it for all of Canada since mid-2021. And I'm doing the same as I'm doing presentations like this. We go around and give presentations for the specialists in dementia care so that they're aware of how to do this testing, how to do the collection. So setting everybody up to do this. So a lot of centers are aware, some of the major centers, but it's something definitely you can speak to your doctor, of course, about if you feel this testing is warranted for them to look into further. So I would say this testing, of course, is new in Canada, but these biomarkers have been around a long time. So we've known about these biomarkers for decades, and they really stalled in the research side. So physicians who participated in clinical trials and things like that had access to them as part of clinical trials. And this is really what motivated us to bring this into care, because they were seeing how helpful this was in clinical trials to accurately diagnose their patients and make sure the right person got into the trial. If it's an Alzheimer's drug, we need to make sure that the person actually has Alzheimer's pathology. So to get in the trial, and it was really at their request that we have access to these in research, but we don't have access to these for medical care. So we partnered with physicians in the province and across Canada to move these things from the research setting into a healthcare setting, doing the appropriate testing, making sure that these were safe and appropriate for use in medical care before we launched the testing. So it is new, I would say, because we only launched it last year for all of Canada, that doctors are still becoming aware of it. So if you are seeing a specialist, they may or may not be aware of it, but we're hoping to reach more and more people as word spreads about testing.
Great. Can the effectiveness of treatment with available medications be measured by the biomarkers?
Ooh, that's a great question.
Mm-hmm.
So maybe before I answer that, I'll just have another small plug for biomarkers. As probably many people on the chat know, we have some very academic people here on the chat. They probably know that clinical trials, new clinical trials for Alzheimer's disease now do not proceed without some measure of these Alzheimer's disease biomarkers. And that's because we know that otherwise, in past clinical trials that didn't use these biomarkers, when we go back and look at them, the people that were diagnosed with Alzheimer's disease to go in the arm of the trial for the testing of the drug, depending on the trial, 20 to 40% actually didn't have evidence of Alzheimer's pathology when we went and looked back. So now we've changed. We understand that these offer another level of accuracy in diagnosis, and so no trial proceeds without those biomarkers. So biomarkers definitely useful for diagnosis, potentially useful for deciding who should go on therapy, right? Because I think probably as the people online are aware, those that have been marketed are quite expensive and not without side effects, some of the therapies that are in the pipeline. And so you want to make sure that you actually have the pathology before you would take that kind of drug. So that's a definite use of these biomarkers. In research, we are tracking these biomarkers and looking how they change in response to treatment. But I would say practically, you know, if I'm thinking of, for me, if I was to go on an Alzheimer's therapeutic, if I needed it and I went on it, how this would be measured today would be looking at my cognitive symptoms. Am I improving? Am I not? Because it's about quality of life and it's about symptoms. But definitely on the back end, there's a lot of research looking at what's happening to the biomarkers. But we don't yet have a medical application for that. So I would say the best evidence of efficacy really is your symptoms.
This presentation today, you're talking about biomarkers specifically for Alzheimer's disease. Understandably, there's been a lot of questions come in about other kinds of dementia. Are there other biomarkers? Is there other biomarker testing for other forms of dementia? Or at this point, is it just for Alzheimer's disease?
Yeah, so that amyloid beta is really specific for Alzheimer's disease. The tau, I didn't get to jump into this, but those are a little bit more general. So tau, actually total tau, which is a measure of all the different tau species you have. So you can think of tau like a Honda Civic, and there's all these different flavors of Honda Civics, you know, maybe some with, you know, a sunroof and some without. So that's why we give these different taus different names, and they have slightly different purposes. But total tau is a marker of any sort of general injury or damage to your brain cells. So that can happen in Alzheimer's disease, but it also happens in other neurodegenerative disorders. It also happens in epilepsy. So you can think of any scenario where there might be some injury or inflammation to your brain cells. That's going to cause tau to increase. So it's really kind of putting these combinations together. And of course, that's a signature for Alzheimer's disease. But when we see alternate signatures in the context, right, of perhaps someone who's getting testing because the doctor has identified that this likely is due to Alzheimer's or frontotemporal dementia, the lack of that characteristic Alzheimer's signature really points to a different type of pathology where, you know, so it can be helpful in actually diagnosing other pathologies, even though we're technically measuring those biomarkers that are specific for Alzheimer's disease. We are actually working on other biomarkers that are specific for other neurodegenerative disorders. Those are a little further behind in the pipeline. So biomarkers, for example, for Lewy body dementia. I mentioned frontotemporal dementia, but frontotemporal dementia is actually quite a complex disorder with a lot of subtypes underneath it. So working on trying to tackle those subtypes to see if we can provide greater diagnostic clarity there. So that's something my research group is actively working on. They're just a little further behind the Alzheimer's biomarkers as far as progress towards clinical implementation, so utilizing in medical care.
Thank you. Several questions have come in. Is this testing covered by MSP? How expensive is it? So if someone has gone through the process that you described, that their symptoms are congruent with Alzheimer's disease, and yet there is some question about the diagnosis, and their specialist refers them for this testing, is there a cost for it?
Yeah, so I can, you know, as a practitioner in BC, I can comment about BC. So if you have a BC PHN personal health number, the test cost is covered. It's currently covered by our lab here in Vancouver. So we're covering the testing, and then we're hoping the Ministry of Health will take over that testing in the long term. But currently, we really wanted to continue that service. We provided this service as part of the Impact AD study, and because of this, the great value we saw, we didn't want there to be any lag between when the Ministry of Health picked this up and when we had to stop that study, because we wanted to offer this continuity of service. So if you're in BC, you don't have to worry about the cost of testing. We do testing for across Canada. Of course, they have their specific funding envelopes in different provinces, so I can't comment on that because I don't know the specifics of it. But we do get samples weekly from across Canada, so it's accessible to people outside of BC.
Is there currently research happening on relatives of Alzheimer's patients? If so, can we volunteer?
Yeah, so there's there's a lot of research certainly in genetic forms of Alzheimer's disease. So with families affected by that. Familial forms, genetic forms of Alzheimer's disease, I should clarify, are those rare cases, right, where there's a gene mutation that's passed along within the family. So it's less than 5%, potentially less than 1% of all cases of Alzheimer's disease. So we want to put that in the context. But those groups generally do look at those broader cohorts of individuals. But I would say, if you're a family member, there's also studies looking for controls, right? So even if you don't have symptoms, right, they're looking for controls around the same age and to match the groups that they have in the affected cohort. So there's opportunities. There's a lot of calls for persons that might not be experiencing symptoms, which I think they're probably referring to be able to participate in research. So I think there's some opportunities that you can search for that would, I know they're out there because I've connected a few people with them, but they're definitely out there because there's studies that have those either as a control group or perhaps an early stage where they're actually just looking at maybe a longitudinal study and see how people progress over time, even when they start at a stage where they have no symptoms.
Cindy asks, where would we find out about those research opportunities? So just kind of some ideas of how and where people
I would
could
say,
look.
It depends on what province you're in, because some provinces have like connected resources. So I can't on the spot name them all right now,
No.
but look at the typical places where you would search for participation in research. Each province kind of has their own sort of connected resources about that. So they're out there, but they're province specific and probably town specific, right? Depending on your availability to travel. Yep. And you mentioned a great one, the UBC Clinic for Alzheimer's Disease and Related Disorders. I know they list their active trials on their website, but there's other opportunities to participate.
If we don't test people when people have no symptoms, don't we miss the opportunity to change the trajectory of the illness? They say the brain changes can start 20 years before diagnosis. Are we just withholding from healthy people with family history due to cost, or is it that there would be no biomarkers at that point?
That's a great question. So definitely these biomarkers are well studied and people with mild symptoms, because we have actions we can take today with that. I think, the situation evolves over time. Hopefully we do have therapies that actually can slow the onset of symptoms, right? And with those therapies, we're all interested in pushing diagnosis to the earliest possible time, right? Because it's easiest to intervene and most powerful to intervene at the earliest stages of the disease. And I will go again back to what we've learned from trials. I know there's been a lot of failed clinical trials in the Alzheimer's disease space, but there's been a ton of knowledge learned. Older trials really targeting more advanced Alzheimer's disease. Those trials now again target earlier stage of the disease because we know we have to intervene earlier in the disease. And that's a prime target for therapies, right? That you want to intervene early when you have the greatest chance of stopping and slowing disease progression. Today with the requirement of CSF, we're not doing CSF and lumbar punctures on normal individuals. We would need greater study of what the potential implications are for those groups, because we don't know your exact trajectory, right? How long would it take to develop symptoms just because we have a biomarker signature versus someone who is symptomatic? We know, okay, they have the signature and they have symptoms. This should be addressed. So again, definitely a push in the future, moving earlier, more accurate diagnosis in the realm of therapies is going to be very important. And things are changing probably as we talk, right?
What are the disadvantages of the test?
Sure. So I would say, it's important to understand that this isn't a black-white thing, right? Like on-off answer to something. These testing, there is some ambiguity. Most people have a positive or a negative biomarker signature for Alzheimer's disease, but there's some that are kind of in that middle ground of which leaves you some uncertainty. So you could proceed with testing. And one downside is you might not get more information. It might leave some uncertainty in the diagnosis. And that's because these groups don't cluster perfectly. Like we don't have the biomarker signature for just Alzheimer's people over here and those without the disease over here. There's that little bit of overlap. So a small percentage of people do get indeterminate results back. So that is one potential downside of testing, is that you might not get the certainty you were hoping for.
Some past research showed people with no dementia symptoms who upon autopsy showed lots of beta amyloid plaques and/or tangles. Your comments?
Well, I think I'd maybe circle back to a question from a couple people ago, right? That there are individuals who demonstrate Alzheimer's pathology, but for some reason don't present with symptoms during their lifetime with Alzheimer's disease. And that's another reason to be careful about applying these tests to people without symptoms, because again, we don't necessarily understand their disease progression. But some really interesting opportunities to better understand why some people are more resilient to this pathology.
Fantastic. That's great. I cannot thank you enough. This has been, wow, the hour has just gone by like that. And this has been such an informative hour, really a large group of engaged people. And I thank all of you for attending. Thank you very much, Dr. DeMarco.
Oh, thank you for having me. And thanks to everybody who listened in and were such active participants in this conversations, a number of great questions. Hopefully we answered most of them, and we shared some new information on biomarker testing.